Hi, everybody. Welcome to week 3. I'm coming to you from my room in New Orleans. We are having a great time. Yes, it's an Aflac convention. That's my husband. He sells Aflac insurance. All right, week 3. So, our lecture this week in the course is about physical assessment. And a lot of it has to do with how do we get our students to do a good job with physical assessment. First of all, we have to be comfortable physical assessment ourselves of each body system and the various components. And I think we need to give our students a lot of practice. I know when I'm working with my students on teaching physical assessment, I always tell them to go home and try to assess as many healthy people as you possibly can. Because once you are comfortable with normal, you can really pick up on abnormal. You might not be able to say the right word for it or describe it exactly correctly, but you know when something is wrong. So learning normal first is good. And then when I had students in lab, I used to do assessment detective. I'd turn on some of my mannequins, kind of the medium fidelity ones. I'd turn on heart sounds, bowel sounds, and breath sounds. I'd make some normal, I'd make some more abnormal. They had to do an assessment. They had to pick up which were abnormal, which were normal, try to describe them, different things like that. So I think giving them opportunities in safe settings first, and then allowing them to do more practice on sick people. Of course, when I had students in clinical, and anytime I heard a really good sound, like horrendous breath sounds or a great murmur, I would try to get as many students as I could in to at least listen to that component of the assessment on that patient. All right, so this week we've got 2 DQs. One is about a patient who we may think is cutting. And it'll be interesting to hear your response to that. It may depend on what your experience has been with those types of patients. The other one is providing feedback to students, and I'm also going to be interested in hearing your information about that. There's no right answer to provide feedback to students, but there are ways that maybe are more effective and less effective. So I'm interested in hearing your thoughts about that. Then we've got an assignment. And basically, you're going to be thinking about the last time that you had a physical assessment performed on you, preferably in an outpatient setting, in like your last physical, in a doctor's office, a nurse practitioner's office, a PA office, whatever it was. And you're going to be looking at all the different components of that physical assessment and critiquing them. One, it helps you pay a little bit more attention to all the things that affect a physical assessment when you're performing them. And also you can identify a lot of different things that maybe you can convey to students to help their patients be more comfortable as they're performing their physical assessments. So I think it's an interesting assignment. It's not too hard of an assignment. Just make sure that you really follow the directions and go down each individual line item. There are an abstract and references that are required for this assignment. So remember, abstracts are supposed to be less than 100 words, okay? And then make sure your references are APA formatted, and you might just be referencing your Bates book or some other physical assessment source, something like that. It doesn't have to be a ton of references. But again, as we go through the program, this is giving you practice with writing an abstract and trying to get down those skills of honing your APA skills when you're doing references and citations. Okay, so doesn't look like too bad of a week. I think this is actually an interesting assignment to kind of reflect back on yourself as a patient. Gives you a little bit more empathy when you have your own patients or when you're teaching students how to care for patients. Okay, kind of short this week. I think that's all for right now, and I'll see you in the main forum.